So what is an endocrinologist? I am somebody who specializes in hormones. That is what I've been trained to manage. And we are going to go on. We're going to do this presentation today going through somebody's journey and a patient's journey. We're going to meet Bulb. I'd like you to meet Bulb, and we're going to go through Bulb's journey with being diagnosed with hypothyroidism and what happens. And hopefully during Bulb's journey, we answer some of the questions that you may have. Bulb, please say hello.
Hi, everyone. I'm Bulb. How are you doing?
Pleased to meet you, Bulb. Tell me a bit about what's been going on.
Oh, I've just been to my GP and they're not listening to me. They keep telling me there's nothing wrong with me, but I'm just feeling really awful. I'm very tired all the time, and my mood has changed, and they keep telling me it's all sorts of things.
Okay. So, Bulb, I hear that you've been on Instagram and you've been reading some things on Instagram.
Oh, yeah. So I've been reading these things on Instagram, and they've said to me that it may be my thyroid that's the problem.
So why don't you check in and see your GP? So Bulb has come to see Bulb's GP, and Bulb asks, are these symptoms related to the thyroid? And normally the medical response is, well, your symptoms are actually quite vague. It can be related to many things. Maybe you're anemic, as where you're not producing enough red blood cells. Maybe you're just growing old, and this is part of aging. Maybe this is your menopause, and you're going through the menopause. Well,
But I really just think that it's my thyroid. I mean, I've read everything and it ticks all the boxes. It is definitely my thyroid, doctor.
okay. If you're convinced it's your thyroid, let's just do some blood tests on you and see what they come up with. Oh, look at this. You have a TSH of 11 and a T4 of 7. It seems that you were right, Bob. You have an underactive thyroid gland. Well, what we will now do is just give you some thyroxine. You take this tablet every single day, and in 6 weeks' time, we'll repeat your blood test. So Bob diligently does this. He goes to the GP every 6 to 8 weeks for the thyroxine doses to be titrated. The thyroid tests are not normalizing after doing all of the things that his or her GP has said. And after another 6 months, Bulb is becoming frustrated and symptoms have not improved. And Bulb is feeling again that nobody is listening to Bulb.
So,
go for it, Bulb.
doctor, I've been on Instagram again, and they said that not everybody needs thyroid. What do you think to that? Is there something else that I could be doing for my thyroid? Because this medication is really not working and I'm still feeling exactly the same as I was feeling before.
So I'm afraid, Bulb, this is what you need to continue doing. This is how we treat things on the NHS. You take your thyroxine and you keep on taking your thyroxine. What we could do is just keep increasing your dose, and maybe we should go up to 125 micrograms.
Okay, but I think there may be something else going on. Or is there something else going on? Or do I have to take this medication for the rest of my life?
You will absolutely, definitely need to take thyroxine for the rest of your life.
Oh, okay. Is there nothing else that I can do?
Not in this clinic, but if you go and visit the Dr. Indra polyclinic.
Okay.
So, well, you decide to go to visit come and visit Dr. Patel at the Dr. Indra polyclinic. Please tell me what's been going on, Bulb.
Right. So I've been to see my GP. They think it's hypothyroidism. They keep giving me more and more medication, and I'm still not feeling right. I still feel tired. I'm putting on weight. My weight is not coming down. My hair has started to change now. They say that it could be my menopause, it could be other things that are going on. But then I've read that there may be other things that I can do for my thyroid, and maybe some other medication, maybe as well.
Okay, so let's start at the beginning, Bob. Do you know where your thyroid gland is?
Oh, nobody's ever told me that before.
So I think everybody can see me. If you feel your neck and you feel the hard bit just here, just underneath, like a butterfly, is your thyroid gland. Just a little bit higher. So not down here, just a little bit further up. And just on either side of it. And often when you go to see your doctor for the first time with your thyroid, this is where we're often feeling your neck. And the reason we do that is that we just want to see, is your thyroid gland swollen? Is there anything else that is going on? So what exactly does the thyroid gland do? So this little gland here is actually a really important gland as to how fast our body works. It affects how our brain is. When it's producing a lot of hormones, we can feel like we need to run around, we constantly have a lot of energy. When we're the other way and we're not producing a lot, we feel very low, tired. Everything is very difficult, everything is very challenging. It can affect our heart rate. It can either slow down or speed up. It can affect how fast our gut moves. Either we could have diarrhea or we could be constipated. So I'm hoping you're kind of beginning to see here, Bob, that what the thyroid does is really regulate how fast or slow your body is operating. And hopefully you can see from this diagram that it affects, controls quite a lot of our body, of what's going on. So let me explain the results that you had. Do you know what TSH is, Bob?
I know people keep talking about this, and then it's kind of going high, and then I'm going low, and I don't quite understand what that's all about.
So we just mentioned your thyroid gland in your neck. It produces two hormones, well, several, but the main ones is T4 and T3. T4 is similar to the tablet that your GP has been giving you, thyroxine. And these hormones go around your body, and this is what is controlling how fast or how slow your body is operating. But it's
Oh,
the T4 that is the active component. It gets converted to T3 in the cells. And that is the bit that goes around and actually does all the hard work to say. So the T4 is more like a carrier for the T3, takes it to the cells. But your thyroid gland does produce 20% of your T3. So when you don't produce a lot of T4 and T3, it goes back to your pituitary gland. And your pituitary gland is just right here. I'm going to take my glasses off so it's easier for everyone to see. Right behind your nasal bridge and right behind there's this tiny little gland called the pituitary gland, and it sits in a little cup in your brain. And one of the hormones it produces is TSH, which means thyroid stimulating hormone. The TSH goes to your thyroid and tells your thyroid whether to produce T4 or not. So when you don't produce enough T4, your pituitary is saying, produces a lot more TSH and says, thyroid, start working, start working, start working. So it pushes out a lot of TSH because it's trying to get your thyroid gland to work. So when you have an underactive thyroid gland, your TSH can go quite high because your pituitary gland is working really hard to tell your thyroid gland start producing some thyroxine. And it can also go the other way, where you're producing so much T4 that your pituitary gland switches off because it's trying to tell your thyroid gland stop producing any more thyroxine. And I personally believe it's very important, Bob, that you understand what these numbers mean, because only then can you understand your treatment plan and what we need to do next. Now, what is often forgotten, and nice of being clear with this, that people with an underactive thyroid often feel better if we have their TSH at the lower end of normal. It's not just about getting your TSH into the normal range. We should be going to the lower end of normal, and that number arbitrary for right now is about 1. Okay.
Mine's definitely been higher than that, hasn't it?
Yes, yes, absolutely. And hopefully, do you see your results that demonstrate that your thyroid is really struggling at the moment to produce T4, and your body is clearly not, even with your replacement, is not getting enough T4, and that is why your pituitary gland is producing a lot more TSH.
Okay. This is really beginning to make sense now.
So you may be wondering now, Bulb, why has your thyroid gland done this? Why does it stop working? Why is it not producing enough T4? There are quite a lot of reasons why this could be happening, but 90% of the time, it's an autoimmune condition called Hashimoto's.
Oh, I've
It
heard that name.
is, have you heard of Hashimoto's before?
Yeah, I've been listening to about that. I didn't realize that I had it.
We don't know if you do, but 90% of cases who have an underactive gland do have Hashimoto's, and that's why I think it's important to confirm what the underlying cause is of your thyroid gland. Your hypothyroidism is. So Hashimoto's is an autoimmune condition. And what is an autoimmune condition? It is when your body, instead of attacking an external, let me think, anything external, say like a bacteria, a bug, a pathogen, it starts to attack itself. And it's starting in the Hashimoto's case, you start to produce antibodies that attack your thyroid gland and destroy the thyroid gland. Hashimoto's was actually the name of a Japanese doctor who first identified it, and everybody now calls this condition Hashimoto's. But he is just the person who first acknowledged this condition. And then you may wonder, well, why are you developing these antibodies that are attacking your thyroid gland? And there are quite a few reasons why. And we would get to the bottom of this by taking a really thorough history. And I would need to take some time to understand your story. Find out everything about you right from the beginning, because it's interesting how little things all come together to help me understand what is the root cause of you developing Hashimoto's. And the kind of things that we frequently see is something called leaky gut. It could be that your genetics make you more predisposed to having an autoimmune condition like Hashimoto's. It might also be that you have some genetics that affects how you convert your T4 to your T3 in your cells. It might be also that you could be deficient in some of your vitamins and nutrients. And that's sometimes related to the leaky gut, because when you have a leaky gut, you're not absorbing all the appropriate nutrients that your body needs. Could be environmental toxins. We're talking about plastics, PBA, stress can precipitate infections. It might have all started off the fact, for example, you may have heard of an infection like EBV, just randomly EBV. And your body has developed antibodies to the EBV, and then it can't stop and it continues and it starts to attack the thyroid. So sometimes there could be an underlying infection that's precipitated all of this. And interestingly, it could also be that if you've had an increase in your iodine intake, for somebody who's predisposed to developing Hashimoto's, that could be the underlying cause. And so, Bob, it's really important that we sit down and we take some time to go through your full story. Another interesting fact is that these antibodies can also present before you actually develop an underactive thyroid gland, which is why we sometimes check them even before you have developed overt hypothyroidism.
Wow. Does that mean that something has been going on even before I even realized that I had symptoms?
Possibly, yes. Yes.
And,
This would have been going on for some time for you. This did not happen overnight.
and you mentioned something about genetics. What's that about?
So nowadays, it's interesting. It's absolutely exciting what we can now do with genetics. And this is just an example of a report that I would ask for somebody that I was investigating the genetics on their thyroid. And really what I'm looking for is the individual's ability to convert to T4 to T3. Because if you think about it, if you're unable to genetically convert to T4 to T3, then T4 thyroxine may not be the appropriate treatment for you. And that is why we often look at genetics. And this is just an example of the kind of report that I would look at. It would also tell me whether you have the genes that make you predisposed to developing an autoimmune condition.
That's really interesting. I'd definitely be interested in that.
So going on from that, and you've alluded to this, Bulb, I keep going the wrong way on this presentation. There are numerous drugs that you could have. I've purposely blurred this slide, by the way, because I didn't want anybody to go and write all these drugs down, that I could treat you with your thyroid gland, Bulb. There is things called NDT, there's Armour thyroid, there's as well the conventional thyroxine, there is triiodine, so T3 I could give you. But here's the thing, and I'm happy to prescribe any of these if appropriate. None of it really works effectively if we haven't actually looked at the underlying cause of your underactive thyroid gland, your hypothyroidism, your Hashimoto's. And this has just been experienced, Bulb, from years, where when I first started and I'd first graduated, that's all I would do is just, but patients were constantly coming back to me and saying they did not feel better on the thyroxine. And even though I'd got their T4 and their TSH into the normal range, the things that I would constantly keep hearing, I still don't feel great. I don't feel well. I just don't feel right. My brain is foggier. I still feel slow. I'm tired. I haven't got my energy levels back. And it's been over years that I've realized that unless we actually support an individual to tackle the underlying cause, I can't support somebody in feeling better.
But these underlying causes are some of the things that you mentioned before.
Yes.
So all those things. Oh, I had been wondering, and I was thinking about asking you to try me on something different to see whether or not that would work. But I guess I need to look at my underlying cause first before I change anything.
Absolutely. And it's not to say that we wouldn't or not necessarily do that in the future, but rather than just jump into that and think that that's going to solve the problem, we should really actually just focus on understanding what's led to this moment in time. And then we can make an informed decision as to what you need to do. But that's also once we've got you, we've actually understood what has been going on. And I have to be honest, most of the time it is often leaky gut.
Can you, I know this is a little bit left field, but can you explain what leaky gut is?
Oh, absolutely. So leaky gut is something that has been studied now for quite some time. And it's when the lining in your gut, due to toxins or anything it doesn't really like, basically, it could be gluten for some, it could be dairy for somebody else, it could have been a bug for somebody else. The cells are normally quite tight in your gut lining, but they've started to split apart. There's been a local reaction that's happened and it's split apart, and then more toxins can come through and they come into your bloodstream. And then your body starts to fight that. And because it's constantly fighting and dealing with that is why often people are feeling tired. But also alongside with that, when your gut is unable to work efficiently and effectively, often people aren't able to absorb the appropriate nutrients that they need. They feel that they're eating a healthy diet, and that's often what I hear. I'm eating everything healthily. I'm eating everything you tell me to, but I'm not feeling better. And frequently, if the gut isn't working properly, if the gut lining isn't healed, then you're not absorbing the appropriate nutrients from what you're eating, and the food can't do what it needs to do. So that's why I'm incredibly passionate about making sure that we look at the leaky gut, exclude it. Well, one first that will come from your history, your story, from us understanding that we'll be able to pick up telltale signs. And then if needed, we can do some testing and then we can support you in managing that.
So what's my next step, doctor?
So what's your next step? Well, you have come to the Dr. Indra Polyclinic. So that means that it's not just me here. It's really important that you get to see everybody in the team.
Who's that, doctor?
Oh, this is Bobby. Bobby is our pharmacist, as well as our happy person. Helps us to feel happy. Bobby's top tip for you right now with your thyroid, and why it's important to see somebody like Bobby and our pharmacist, is because he will go through things like your drug interaction with your medication, and for example, your timing of your medication. For example, it is really important to take your thyroxine first thing in the morning, and there should be at least an hour before taking your thyroxine and taking any other medication. That's just one example of the kind of things that Bobby would go through with you for you to understand what's going on. This is Corey. Corey is our nutritionist. And you may say, but I have a healthy diet. Why do I need to see Corey? Hopefully I've explained why I believe that the gut is so important in this. And Corey would really help with this, with understanding how you're digesting your food, are you absorbing, and then supporting you with a plan to deal with that.
That's a lot of people, but I think I'm beginning to see why.
This is Ruth. Ruth is one of our psychotherapists. And you may say to me, but I don't need to see a psychotherapist. No, you don't necessarily. But where seeing somebody like Ruth is really good, and where her top tip is that she'll support you to, well, what she has said to me, but her top tip is learn to slow down, get quiet, and listen to the wisdom of your body, mind, and spirit. It's always there guiding you. Do you have anything to say about that, Bulb?
Is that to do with stress or something? I didn't think that I was really that stressed.
So it's interesting, isn't it? We think as stress as a stressful situation, like maybe having an argument with your partner or trying to get your kids to get out the front door on time. And we all think of that as a stressful situation. But actually, there's a body stress that's going on internally. And when our body is in a stress mode, it's in a fight mode.
Oh,
Therefore, when it's fighting internally, it doesn't have the ability to be able to heal. And by slowing yourself down, you help your body to relax, that you're helping your body to understand and know what it needs to do, and to be able to give an opportunity for everything else to work. But it's a
oh,
little bit like, you can imagine if you've blown a balloon up really, really, really to the maximum, and it's so tight, there's no space for anything else. And it's only until it relaxes and calms can you get any more air into that balloon.
maybe I don't realize how much stress I'm carrying with me.
Absolutely. I don't think most of us do. And it's about being able to build up the inner resilience in our bodies, to support our bodies to be able to relax and to be able to do what we need to do during the day.
Wow. Who else have you got in your clinic?
Well, this is Nikki. Nikki is our happiness coach, and her top tip for my thyroid patients are incorporating relaxation techniques like deep breathing meditation, yoga, or walking in nature into your daily routine. By reducing stress, you can help balance your hormones. Remember, a calm mind supports a healthy body. Just sit with that for a little bit. I really love that sentence. A calm mind supports a healthy body.
Wow. That's again about stress, isn't it? They're all kind of speaking to that sense of being a little bit calmer than what we all are.
Yes. This is Elsa. She's one of our GPs in the Dr. Indra practice, and her interest is in environmental toxins. And she's also always keen to remind us not to forget about looking for things like BPA, metals, fluoride, chlorine. Don't to forget other environmental things that could have also precipitated the developing Hashimoto's. And it's great that in this clinic we have somebody like Elsa who really focuses and specializes on this area. This is Dr. Pratima. Dr. Pratima is a psychiatrist. Don't panic.
I don't need to see a psychiatrist.
You absolutely, at this stage, do not need to see a psychiatrist, but I think it is very important for us all to be aware that especially when you have developed an underactive thyroid gland, it can result in us feeling very low in mood and very tired. And sometimes it is just, as much as we also have to look after our body, sometimes we have to look after our heads. And having somebody like Dr. Patel here is, again, it's just a really good, she's a great person to have around to be able to discuss or to be able to see if needed. Because as I have just said, we all sometimes just need to also support our heads as well as our bodies.
Okay. It's nice that everybody's under one roof, isn't it?
Yeah, and the advantage of this is that you don't need to see everybody in one go. We meet together and we will discuss our cases. So you don't also need to see everybody. You don't need to see us all. And you just need to see a combo of us. And just for completion, this is our admin team who support us in the background. And without them, it would be very hard to manage all our cases.
But this is who I speak to if I've got any issues.
Absolutely. If you have any queries, any concerns, anything, they're always on hand to answer your questions. So, Bulb, I'm really pleased to say, having seen you 6 months later, we have focused on the last 6 months on diagnosing and managing your leaky gut. You've taken your appropriate supplements, you've seen the appropriate members in the team, you've done an amazing job on focusing on your stress levels. You're feeling a lot better, your energy is improved, you're losing weight, and your thyroid functions are in a great place. TSH has come down to 1.2, T4 is 22, T3 is 5.6. Congratulations.
Thank you so much. Yeah, I definitely feel so much better 6 months down the line.
So we're going to open this up to questions literally quite soon. Indy, did you want to go for this bit or shall I go through this?
Are you letting Bulb go now?
Bulb, you may disappear now. Thank you for your time.
Thank you so much, everybody. Thank you, Tash. It's interesting being Bulb and actually kind of going through that and trying to understand everything that's involved in. Hope everybody's enjoyed that. So as Tash has talked to you in our presentation today, we are a multidisciplinary functional medicine team. We like to call ourselves a collaborative care team because all of us collaborate together to support us. And we've also got our CQC registration as well. And this means that we can see the whole person and we like to treat the whole person. And we're also now starting to treat whole families by looking at it in some completely different way. Did you want to go on to the next? So for me, this picture kind of tells me what functional medicine is. Functional medicine for me is getting to the root cause. As Tasha has spoken about bulb, we take a history, we look at the whole picture because it's more than just the thyroid. And that's why we have the doctors there, we have the lifestyle coaches, we've got our psychotherapist, we have our nutritional therapist. This picture needs to be updated with all the members of the team that we have here. And functional medicine for me it's a scientific approach to really understanding what is going on in the body. This is a key part of what I say always. We are all whole and you have innate health within you. Hopefully that makes sense to people. You have innate health. Our bodies are all designed to always bring us back to balance. So even the thyroid for me, one of my things that I say to a lot of my patients is, why is your body asking you to slow down? Because that's what the thyroid is doing. It is asking you to slow down. So all the things that Natasha has discussed with bulb, we need to understand what's going on for the whole person and really connect with that innate health that's really present within us. This is what we base our functional medicine approach with: 5 core principles: the innate healing capacity, the genetic uniqueness, as Natasha has spoken about, inflammation. We don't really cover that today, but it kind of is why the inflammation is happening. in bulb's history. Inflammation to me is the fire, that sort of rumbling fire that's going on underneath us, that is creating some of the disruption that allows the antibodies to develop along the way and causes some of the leaky gut symptoms that Natasha was talking about. And the other principle is it is a scientific biochemical balance. We really want to use science to understand what the body is going to. We've had this a lot of the time that, you know, Wikipedia says you're a load of quacks. This isn't real medicine. But the more and more that we see that there is so much science behind what we do, we are really trying to bring functional medicine way up into into what this should be, really just normal medicine. This is what we should be doing for everybody, in every person that we're doing. But we've forgotten some of these principles as we have taken conventional medicine into its own realm of pharmacology and all sorts of other things. And the fifth principle is vitality over disease absence. We want you, we all want this. We want to just be vital. We don't just want to be well. And we want to be vital to do exactly what we want to do in our lives. And that is really something that we speak about to our patients all the time. We want to know your why. We want to know, why do you want to become well? That was one thing that I think Bulb was supposed to talk about. We forgot to talk about it. But, you know, why is it that you want to be well? And people here who are practitioners, who are working with health coaches, all of this, working with the patient's why really allows them to connect, to make all the changes that we're asking them to asking them to do. You know, taking supplements is not an easy thing to do. Making nutritional changes is not an easy thing to do. You then become weird. Why are you doing this? This is all a bit different. And that's, you know, that's really important, to understand your why and become that vital part of you. I think that's it. Yeah. So hopefully you have enjoyed this presentation. We've gone through a little case history of thyroid, and we've discussed a number of different things relating to thyroid, and we've got some wonderful questions coming up here as well. If you do want to book a discovery call with with our team, this is some of the numbers there for you, and we will put a link into the chat in the moment. But thank you very much, everybody. Hope you've enjoyed that. It's a slightly different way of presenting thyroid disease.
Okay, shall we go through some of these questions that have come up?
Yeah, definitely. I want to just introduce my team, our team here who are here today. So please all jump in, team, with any of these questions that are coming up. Tash, do you want to take the questions? Do you want me to read them out?
Could you, because I've lost it, that it's gone from the screen.
Okay, thank you, everybody. You want to stop share, Tash?
Stop share. Fantastic.
So you found it?
Yeah.
Okay. So if someone is not able to convert T4 to T3, why is the underactive thyroid symptoms not present at an early age? Very good question, actually.
It is a really good question. In some people, it's sometimes there's like a final straw that's just pushed them over. So that's where the Hashimoto's has come into it. So most of the time you can manage, but then you develop something like Hashimoto's, and then that's when it all starts to become relevant, because you're not able to convert any of that T4 to T3, and your thyroid gland has been destroyed, and you're not producing enough of your own T4. And prior to that, you probably were producing enough T4 to compensate for that. So that is probably why we're not presenting at an early age. There is forms of genetic thyroid disease that does present in childhood that is completely separate. What we're talking here at this stage are individuals who are managing, and their thyroid was producing enough thyroxine, and then the thyroid has been attacked by their own antibodies, not working anymore, not producing enough thyroxine, and then you start to note this difference. And especially when you're giving them synthetic thyroxine back again, and their doses are going up and up and up because you're trying to eliminate their symptoms and it's not working. that's when then finding in their genetics and their predisposition for having this and their inability to convert T4 to T3. I hope that helps.
Does any of my team, Pratima, anybody wants to add to that? No.
Yeah, and I guess on top of that, sorry, I'm Corrie, I'm the nutritional therapist at the Dr. Indra clinic. Just also in terms of genetics, so your genes can switch on and off depending on the environment. So over time, your immune system, it does get older, so therefore you might have more inflammation. You may have had some toxin or chemical exposure, and that might have pushed you to that limit that Tash was talking about. And then you look into your genetics and see that there was always the possibility of that happening, but it doesn't mean that it would definitely happen.
Yeah, I think the key important thing to remember is that our genetics only give us 30% the risk of developing any condition. 70% of the time, it is actually our environment that we're living in that actually influences the genes that we are expressing at that time.
And Indra, just to add, what you said, that our natural state is in innate health. And what I see from a psychiatric point of view, that, there would be a big life event, an acute stressor. So what the body has been compensating in order to try to maintain homeostasis suddenly is overwhelmed. I find like those acute stress episodes often turn on the genes, and that's although the environment, was more manageable before that.
That's amazing. Yeah, exactly.
Yeah, I think that's one of the big things that we look at, isn't it? As through functional medicine, sorry, I'm Nikki, I'm the health coach at the clinic. Hi. A big part of our investigations when we deal with our clients is really looking at your life story and really taking the time to understand what you're going through and what's happening in your life and the stresses and the different things that you're trying to juggle. And I think as we look back through people's life stories, there may be really big stresses in people's lives, there may be bereavement, there may be relationship troubles, there may be really difficult situations with children or with family or with work. And I think a big part of the health coaching and as the team working together is to really try and understand your story, to help you deal with stress, to help you overcome things from your past that you're still trying to overcome, to help you really get on top of the sleep. If you're not sleeping very well, that's going to be a big trigger for ongoing inflammation in your body, and to try and get you moving and actually getting some joy back into your life and able to do the things you like to do. So a big part of what we're doing as a team is to try and not only address the medications and the diet, but also trying to build you up to be more resilient, to be able to cope with the kind of tools and the techniques to help you deal with what's going on in your life, and to really understand you as a person, and to help get you through this journey and come out the other side really thriving.
Thank you, Nikki. Hopefully that answers your question. But Lynn, next question. What are the optimal blood tests for B12 and vitamin D for someone with Hashimoto's? Tash.
I think without actually seeing the results and talking to somebody and going through the whole story, it's slightly challenging. So for me, vitamin D levels also depends on other factors as well and what the optimal ones are. I always like my vitamin D levels to be at the higher end of normal rather than the lower. And it's something actually I've researched quite a lot into. It's interesting that the values that we currently use on the NHS for vitamin D came out like 30, 40 years ago when the population was completely different. And the vitamin D levels that we are told currently on the NHS doesn't actually portray the population that we're in at the moment. So I'm not sure how appropriate it is. So I can't say that to you right now, what the optimal B12 and vitamin D would be. That would have to be in a consultation and talking to somebody to really see what we should be aiming for. For example, if somebody has kidney disease, I wouldn't be vitamin D, pushing up your vitamin D level wouldn't be too appropriate, because you need your kidneys to activate your vitamin D. Do you see what I mean? So that's quite a medical question. So yeah, feel free to book in for an appointment or a chat, and I'm more than happy to discuss that and see what your vitamin B12 and vitamin D levels are optimal for you. But definitely we wouldn't want them to be low. We would want them to be at the higher end. And again, high levels of B12, we've got to be careful, because that can mean other things. And I often see that in things like I'm going to use an abbreviation here, SIBO, small intestinal bowel overgrowth. So sorry, I can't answer that question a bit more.
But that's important to know that it's very personalized what we're doing. It's about understanding you and what's needed. Elsa, did you want to talk about vitamin B12 at all? Is she there? Or has she dropped off?
Okay, she's dropped.
She's dropped. Bobby, did you want to mention anything?
Yeah, so I think, yeah, what Natasha was saying, it's so nuanced when we're looking at these levels, and there is such a variation. And I think, like Natasha said, some of these levels are based on things from 30 odd years ago. And also, I think from what I understood about the vitamin D levels, they were based on people only for their bone health. So it wasn't really taking into consideration all other parts of the health. So another field I work in is oncology, and we use levels way, way higher than what is recommended for the norm, because that's only relating to bone health from 30 years ago, where things were very different. So they are really nuanced. And I think the other really important thing is, you know, we often feel that it's going to be perfectly fine if these are the things that could improve this condition, let's just take them. And every now and then we can just tip over a little bit. And very often when it comes to some of these wonderful micronutrients, the signs of deficiency can be equal to the signs of excess as well. And so we need to be very cautious on that. So we don't want to be causing more symptoms that might look like a deficiency, but they might be in excess. So optimizing individually to your uniqueness is so key.
Thank you, Bobby. This is something that we've started to see, isn't it? We've had patients that are sort of coming to us with 20 different supplements because they keep adding more and more supplements to what's happening. So it's about understanding why we're giving it for what reason. Next question. Is borderline high end of the range liver and kidney result and an IgA blood result over high end of range linked to hypothyroidism?
Again, technically, no, but I would need to sit down and go through. I don't want to brush this off completely, but I would need to sit down again, go through the story. But this isn't something that stands out, that necessarily that this is connected to hypothyroidism. But you know, it's only when I sit down and go through somebody's case and story, then I start, like any of us are able to pull any of this out together. And there may be other things that are going on. So again, unfortunately, I don't think I can answer this question. Indeed.
Yeah, I think that's right. Leslie, are you around? Do you want to open that up a little bit? Do you want to unmute yourself? Let's see.
She's still
She's around. Yeah, she might not be there. That's fine. The next question here. Interesting thyroid function overview. I see quite a few patients with chronic illness with deranged TFTs, almost all taking thyroxine with little effect. Yes, Georgia, that's something that we are seeing quite a bit as well. And
yeah.
Okay.
I think hopefully that's what was covered in the talk, though. This is why we're seeing this, is because we're not looking at the underlying cause of why the thyroid function is off. And it's until we do that, then somebody doesn't tend to feel better. Really, the thyroxine is just putting a plaster up on a crumbling wall. It's not really solving the underlying issue.
Perfect.
Yeah.
And we've got one more question. Can type 2 diabetes trigger Hashimoto's condition or vice versa?
No, not type 2s, and it's not that it triggers, but type 1 diabetes is also an autoimmune condition and can be associated with it. So it's an association, and by the fact that they're autoimmune. So if you have one autoimmune condition, you're at risk of having another one unless we tackle the underlying, but not type 2. Type 2 per se, it doesn't mean that somebody can't have type 2 diabetes and Hashimoto's, but it's not the same path and process that's triggered it.
Amazing. There's another question here. Do you also work on optimizing the liver and adrenals to achieve thyroid health? Would you consider these as being possible root causes?
Absolutely. I mean, that's where the whole story comes into it. That's where only until we take somebody's story and absolutely understand what has gone on, that can we determine what the root cause is and where we need to focus on. So it could be that, it can be, it could be the adrenals, but that adrenals is often, we were talking about, that's related to stress. And that's what everybody in the team was talking about earlier. And the liver is related to detoxification, and are you able to get rid of some of these toxins that may have triggered this all off in the first place? Indy, there was also, I hope that answers that. I don't know if anybody else wants to answer. And there was one more question at the top that was missed.
All right. Okay. Well,
Does anybody else from the team want to answer this one as well, about the liver and the adrenals? Oh, okay. Then I've got a question for Corey, which was at the top. I think, Corey, this is right for you. It was, how do you diagnose leaky gut?
oh yeah, I saw that.
So, I mean, so you can do some testing, but in general, it's quite easy to see by taking someone's history and talking to them about their digestion and what else might be going on for them. And Tash really well explained leaky gut really well earlier. And there's so much we can do in terms of nutrition to support that. So also, when we've been talking about stress a lot, we're thinking about needing to be in rest and digest to be able to absorb the nutrients that you're taking in. So we do a lot of work on being in rest and digest. The parasympathetic nervous system, when you're calm, you're able to take your food in and digest that fully. So we look at that a lot in the consultation.
If there's anything I'd like to bring home to everyone from all these questions, is the importance of your story. It is so important, and that's why the difference between the consultations that we do here in this practice to what I would do on the NHS is that I have time to sit down and to listen. We all do. We all take that time to listen to you and your story, and that's then how we're able together to work out your most appropriate plan.
Before we've got about 8 or 9 minutes left, Leslie is struggling with her phone a little bit, but does want to elaborate. So I'm going to let her type out a question, so that type out her information about, I think Leslie's question was about the thyroid and function. No, hold on. The liver, kidney, and IgA blood test. Okay, so let's just summarize at the moment. We've got lots of top tips that you've given out about thyroid function. Shall we all just pick out, or do you want to summarize what your top tips are that are coming through from this conversation?
Me or everyone?
You.
I think for me, it's being diagnosed with hypothyroidism or an underactive thyroid, same thing, is means that there is something else deeper that is going on, and that is what we need to investigate and find out. The thyroid is more of a symptom. What's going on underneath? Let's dig further and find out what that is for overall wellness.
Amazing. I think what I'm seeing from this talk today is that we need to be looking much bigger than just the thyroid, and we have to look at the dance of all the hormones that are happening. It's not just the thyroid, there's other things that are going on around you, and we need to look at our gut, and we have to look at understanding how your body's working. The biggest thing I want everybody that's coming through our clinic is to leave with an understanding of how their body works. If you understand how your body works, when life happens, I want you to have the tools to be able to know what to do for yourself. You don't want to necessarily keep coming back to us to see things, but to be able to know, right, this is how my gut works. This is what happens when I'm under stress. These are the kind of nutrients my body needs. And maybe we may do some genetics for you, so you know that there are some predispositions that you may have, so that you have the tools to own and allow you to achieve the kind of health and vitality that you want to have. Leslie has just typed in here saying that these are the results that she's been told, that those symptoms that she mentioned on here is associated with her thyroid. So I guess until we know more, Leslie, we'd have to see why that's associated with it, because a secretory IgA may be related to your gut health and your immune system in your gut not working as effectively for you at this moment in time. So there may be that's why it's related. And low folate may also have an indication relating to your ability to absorb your nutrients.
Yeah.
And we know that for your thyroid to work effectively, there are a number of nutrients that you need for it to work effectively. So it kind of makes sense what you said in your test results there, but I'm kind of trying to extrapolate it to what we're seeing with our thyroid patients as well. So hopefully that makes sense to you. Look. So I've just put in here a little message here. If you could all it'd be really lovely if you'd be able to give us a little bit of feedback from this webinar. We've also got a link for you to book in a call with our team members so that they can answer any questions or give you some further information about our team as well. Does anybody have any questions that they want to ask? If they want to unmute themselves and ask a question, we've got a few minutes here. No? That's amazing. So hopefully that has really explored thyroid disease to everybody, and everybody that's signed up for this will get a copy of this webinar as well. And does any of my team or our team want to say anything before we finish today?
Oh, just to say thank you for being here on a really beautiful hot evening. Really appreciate it for your time.
Thank you, everyone. We'll see you all soon. Take care.